Did you know that 10 million Americans over 50 are silently battling a disease that could make their bones snap like twigs from a simple fall? That's right. Osteoporosis is a hidden epidemic, and today we're diving deep into what it is, how it's tracked in the medical world, and why it matters to you. Stick around, because by the end of this video, you'll not only understand the critical codes doctors use to diagnose this condition, but also learn practical steps to protect your bones and live stronger. Let's break it down. Welcome to Bone Well. Today we're tackling osteoporosis, a condition that affects millions, but often flies under the radar until it's too late. We're going to explore the International Classification of Diseases, or ICD-10 codes, that doctors use to diagnose and track this bone-weakening disease. But this isn't just about numbers and codes. It's about real people, real risks, and real solutions. So grab a glass of water, and let's get started. What is osteoporosis? First things first, what exactly is osteoporosis? Imagine your bones as a sturdy scaffolding that holds your body together. Now picture that scaffolding getting porous, like a sponge, losing its strength over time. That's osteoporosis. It's a condition where your bones become so weak that even a minor bump or cough can cause a fracture. According to the National Osteoporosis Foundation, 1 in 2 women and 1 in 4 men over 50 will break a bone due to osteoporosis. That's staggering. In the US, about 10 million people over 50 are living with osteoporosis, and another 44 million have low bone density, putting them at risk. But here's the kicker. Osteoporosis is often called a silent disease because you might not know you have it until you break a bone. So how do doctors identify and track this condition? That's where ICD-10 codes come in. ICD-10 stands for the International Classification of Diseases, 10th revision. It's like a global dictionary for health conditions, used by doctors, hospitals, and insurance companies to standardize diagnoses and treatments. For osteoporosis, there are over 280 specific codes that capture everything from the type of osteoporosis to whether a fracture has occurred. These codes are critical because they help track the prevalence of the disease, ensure accurate billing, and guide treatment plans. Let's look at some of the most common ICD-10 codes for osteoporosis, based on data from 2021. The top code is M81.0, which stands for age-related osteoporosis without a current pathological fracture. This code alone accounted for over 74% of osteoporosis diagnoses, with nearly 7 million cases. Why so high? As we age, our bones naturally lose density, especially after menopause for women, making this type of osteoporosis the most common. The second most used code is Z13.820, which is for encounters related to osteoporosis screening. This code logged over 1.3 million diagnoses, about 14% of the total. It's no surprise, doctors recommend regular bone density scans, like DEXA scans, for women over 65 and men over 70 to catch osteoporosis early. Then there's M81.8, other osteoporosis without fracture, which covers cases like drug-induced or idiopathic osteoporosis, with about 411,000 diagnoses. Why these codes matter? Now you might be thinking, okay, these codes are important for doctors, but why should I care? Great question. These codes do more than just sit in a medical chart. They help researchers understand how widespread osteoporosis is, which informs public health policies. They also ensure that patients get the right treatments covered by insurance. Without accurate coding, a patient might not get the medication or therapy they need to prevent a life-altering fracture. Here's my take. The medical system can feel like a maze, and ICD-10 codes are like the map. But they're only as good as the doctors and coders using them. If a code is misapplied, it could delay treatment or even lead to denied insurance claims. That's why understanding these codes empowers us as patients to ask questions and advocate for our health. To make this real, let's talk about two people I've come across whose stories show the impact of osteoporosis. First, there's Maria, a 68-year-old retired teacher. Maria was active, loved gardening, and had no idea her bones were weakening. One day, she tripped on a hose in her backyard and fractured her hip. A DEXA scan confirmed osteoporosis, coded as M80.051A, age-related osteoporosis with a current pathological fracture of the femur. Maria's life changed overnight. She needed surgery, months of rehab, and now takes bisphosphonates to strengthen her bones. If she'd had a screening earlier, coded as Z13.820, her fracture might have been prevented. Then there's James, a 55-year-old gym enthusiast. James was shocked when he fractured his wrist during a routine workout. His doctor diagnosed him with idiopathic osteoporosis, coded as M81.8. Unlike Maria, James didn't fit the typical profile. He wasn't elderly, and he wasn't a woman, but his case shows that osteoporosis doesn't discriminate. James now works with a nutritionist to boost his calcium and vitamin D intake and checks his bone density regularly. These stories hit home for me because they remind us that osteoporosis isn't just a number on a chart. It's about real people facing real challenges. Maria and James didn't see it coming, but their diagnoses, tracked by ICD-10 codes, helped them get the care they needed. Now let's zoom out and think about what these codes tell us about osteoporosis as a public health issue. The fact that M81.0 dominates with over 6.8 million diagnoses screams one thing: aging is the biggest risk factor. But here's where I think we need to push further. Our healthcare system is great at coding and treating osteoporosis after it's diagnosed. But what about prevention? Only 14% of diagnoses were for screenings. That's not enough. We need to normalize bone density tests as routine as mammograms or colonoscopies. Let's talk risk factors. Aging is non-negotiable, but other factors, like low calcium intake, smoking, excessive alcohol, or a sedentary lifestyle, are things we can control. Caucasian and Asian women over 50 are at higher risk, but men, like James, can be affected too. And here's something the data doesn't show, but I've seen in my research. Socioeconomic factors play a huge role. Not everyone can afford DEXA scans or medications, and that's a gap we need to address. On the treatment side, medications like Prolia or Reclast, coded under various ICD-10 codes, are game changers for slowing bone loss. But they come with side effects, and stopping them can be tricky. My advice? If you're prescribed these, talk to your doctor about the long game, how long you'll need them, and what happens when you stop. And don't sleep on lifestyle changes. Weight-bearing exercises, like walking or lifting weights, can make a huge difference. What's new in 2025? Since we're in 2025, let's talk about what's new. The Centers for Medicare and Medicaid Services recently added 252 new ICD-10 codes, effective October 2024, with some expanding details for bone and joint conditions. While the osteoporosis codes, like M81.0 and Z13.820, haven't changed, these updates show that the medical field is constantly refining how we track and treat conditions like osteoporosis. It's a reminder that science is always evolving, and so should our approach to bone health. So, what's the big lesson here? Osteoporosis is a serious condition, but it's not a death sentence. Thanks to ICD-10 codes, doctors can pinpoint and treat it with precision, but the real power lies with you. Get screened, especially if you're over 65 or have risk factors. Eat foods rich in calcium and vitamin D, stay active, and talk to your doctor about your bone health. Knowledge is strength, and today you've got the tools to protect your bones and live life to the fullest. If you found this video helpful, give it a thumbs up, subscribe for more health insights, and drop a comment below. Have you or someone you know dealt with osteoporosis? Let's start a conversation. Until next time. stay strong, stay healthy, and I'll see you in the next video. If you've made it this far, I know you're someone who truly cares about your health, especially the strength of your bones and joints. Thank you for watching this video. I hope the new tips and insights we've explored together will help you live a healthier, more vibrant life every day. But here's a quick heads up. On platforms like YouTube, you might come across ads from pharmaceutical companies promising miracle products. Remember, lasting bone and joint health doesn't happen overnight. Issues like joint pain or osteoporosis take time and consistency to improve. Instead of chasing quick fixes, trust in the power of a natural lifestyle. Eat wholesome foods, stay committed to exercises that support your body, and keep learning about how your body works. Which tip from this video did you find most helpful? Drop a comment below. I'd love to hear your thoughts. If you enjoyed this content, don't forget to hit like, subscribe, and ring the notification bell so you never miss our upcoming videos. Let's build a healthier future together, starting today. Disclaimer: the information provided in this video is for educational and informational purposes only. The information provided is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or watched on this channel. Reliance on any information provided by this channel is solely at your own risk.